This is what all sides say they wanted to avoid. The sight and sound of tens of thousands of nurses on strike.
For us to come out today, you can see all nurses, they're happy. Not because of anything, they're happy because now they have a voice. And strength is in numbers. The larger we are, the more they will have to listen.
Stephen Barclay's got to go!
For months, the Royal College of Nursing and the government have been deadlocked over pay and working conditions.
It's a tragic day for the NHS. The NHS has been run down by this government and left in a crisis. What we're trying to do today is to actually save our NHS.
The Health Secretary, Steve Barclay, says demands for a 19% pay rise aren't affordable and would impact health services. He's sticking with the proposal offered by the independent pay review body.
If we were not meeting the recommendations in full, I'm sure I'll be asked as to why, when there is an independent process, we haven't followed that. We have, and it's important that the trade unions do as well.
So there's no room for negotiations?
Well, there is room to discuss, as I say, a wide range of issues, because there's many issues that impact on nursing, but we have followed the independent pay review process.
That's where we should have been today and yesterday.
Neil and Roni Mounter are used to delays. The pandemic has meant it's taken nearly 2 years for Neil to be diagnosed with a rare form of blood cancer. He's now started treatment, but his appointments this week have been delayed due to the nurses' strike. Roni, who works for the NHS, is sympathetic to the nurses' cause, but knows every delay could be costly.
Between the train strikes and the RCN strikes, it's not good for Neil, it's not good for me, it's not good for our children. We're still not sure of what the actual prognosis is, but they are at least, trying to treat Neil and to make him more comfortable. And at the moment, he's not.
Hospitals where nurses have voted to strike have had to plan ahead as best they can to minimise disruption to their patients.
We're working with all of our staff to work out how we can recover after each of these days. But obviously, if there are increasing numbers of strikes, that will have an increasing impact.
The nurses here do not want to keep striking, but unless their demands are met, or at least considered, they say they have no other choice. Some 70,000 appointments had to be cancelled today, and this is only the beginning of the industrial action. With every strike day, tens of thousands of more patients will be affected, and they'll all need to be seen at some point. All of this builds more pressure on the NHS. And with a 7 million strong waiting list that is growing all the time, something or someone will need to give before it's too late. Ashish Joshi, Sky News at St Thomas's Hospital in London.